While the whole province faces the same stay-at-home order today, not long ago, some cities had glimpses of normal, such as indoor dining and haircuts. With us now on how the return to lockdown is playing out, we've got 3 different regions of Ontario represented. And as is our custom, we'll introduce them from furthest away to closest to our studio. Starting with Bill Mauro, who is the mayor of Thunder Bay. He's in northwestern Ontario. Bernadette Clement is the mayor of Cornwall in eastern Ontario. And Tom Mrakas is the mayor of Aurora in York Region in the Greater Toronto Area. And your worships, good to have you all on our program tonight. I want to start by bringing up a graph which indicates in your respective regions what COVID-19 has been doing over the past year in terms of new and active cases. And for those who are listening on podcast and who can't see this, let me just describe it in some detail. We've got 3 lines, 3 different colors. Thunder Bay is the gray line. And as we look at that one, that has been fairly steadily under control for most of the past year. A bit of a spike in March, but otherwise, relatively speaking, under control. We'd say the same thing about the blue line, which is Eastern Ontario. A bit of a heartbeat there as we've come into 2021, but essentially under control. But then York Region, which is the orange line, a huge spike in January, then brought back down under control by March. But in April, that line is pointing towards heaven. So, Mayor Mrakas, I've got to get you in here first. Why does it appear as if COVID-19 is out of control in York Region right now?
Well, Steve, I think ultimately what we're seeing is that the areas that there is a high transmission rate really hasn't been solved. I mean, 44% of workplace outbreaks are happening in our manufacturing sector, yet they're still open. And so that's why there's a big push as far as from taking an aggressive, targeted approach to vaccinations and looking at getting in there and vaccinating those in the manufacturing sector and all of our essential workers, because we need to curb the cases that are just continuously growing at this point.
Mayor Clement, what's the story in Eastern Ontario where you are?
So as the line shows, we had a pretty good run up until Christmas. And then since Christmas, it's been a real struggle. And this third wave has really sent a little bit of a shock wave through our community. And we're being told by our hospital CEO that the hospital is now sending patients to hospitals outside of our area, because they need to be able to manage the influx of cases, COVID cases. Our hospital in Cornwall is the regional COVID hospital for Eastern Ontario in Stormont, Dundas, Glengarry, and Prescott Russell counties. And so it's important that the Cornwall hospital be in good shape, and we're being told that it's not.
Mayor Mauro, how are you managing in northwestern Ontario?
Well, we are, as we speak, Steve, in a much better place today than we were 2, 3, or 4 weeks ago. 2 or 3 or 4 weeks ago, I think we had the highest incident rate in the entire province of Ontario. That's referenced in the spike on your graph that you put up on the screen a little while ago. And so since then, our numbers have greatly improved. They are seeing a downward trend over the last 2 to 3 weeks. That is very encouraging. However, I think the caution, certainly for me as mayor, and I think for the entire district of our health unit, the variants are here, but they have not yet spread to any great degree. We all appreciate and understand that they are considered to be and are much more infectious. And so for that reason, I remain very cautious in terms of what we're going to see over the next couple of weeks.
There's always a question when a stay-at-home order is brought in by the province, across the whole province, whether that's the right way to go. And Mayor Mrakas, I'll get you to weigh in on this. Whether you're a community of 2.5 million, as the capital city is, or 100, like Kagawong on Manitoulin Island, it's the same approach. In your view, is that the way to go?
Personally, I don't. I think that I think from a GTHA perspective, I think we need to look at it as a whole and as one unit, because we are so close and people are constantly moving from one region to another, as far as for work purposes or just trying to get vaccinated. But in northern regions and more rural settings, I don't think that they need to be put into the same circumstances as far as the whole GTHA. So I don't think it's a one-size-fits-all approach. And, I really, really do wish that province would look at that and maybe kind of make some adjustments to this, because I think it's unfair to those rural areas that are not seeing a high number of cases, and for all their businesses and everyone to be shut down.
Do I infer from your comments that you don't think there should be a lockdown order in Aurora right now?
Well, no, I think that Aurora, because we're part of the whole GTHA, I think that we need to move forward as one unit. So no, I do think that we do need to be in a lockdown right now, but I do think that it needs to be looking at all sectors and creating a level playing field, so that it's not just penalizing or punishing one specific sector where we're not seeing the transmission occur.
Okay, Mayor Clement, how about you? In Eastern Ontario, do you think the one-size-fits-all approach makes sense where you are?
Well, the conversation changed this year. Last year and last summer, our numbers were good, and we were feeling a lot more confident. Right now, and the way that our geography works is we're quite on the border with the U.S. We're also on the border with Quebec. We're also close to the Ottawa region. And so at this point, with cases rising all around us and here in Cornwall, I think we have to be following the rules as much as possible along with this current lockdown to get this thing under control now. We see the light at the end of the tunnel, but we have to stay the course. And so right now our community is struggling to follow the rules as much as we can to get through to when we can all get access as much as possible to vaccines.
Mayor Mauro, the lockdown in Thunder Bay, people accepting it there?
I think, Steve, generally it's fair to say they're accepting it. But again, this is about the variants. If the medical advice is that the lockdown stay-at-home order is necessary to contain the variant, if that's what's driving the current policy position, then I think we can all accept that. But I think if that is what's driving the policy decision that the province has made, then it needs to be tied to very closely the vaccination plan rollout. Because if Thunder Bay, with our numbers going down significantly over the last 3 weeks, is included in this pan-provincial lockdown because of the variant's potential, increase in the numbers, then I think that we need to be accommodated the same when it comes to the vaccination rollout across the province.
I'm going to play you a clip now, Mayor Mauro, of a guy that we had on this program on budget night. You may know him, Tony Muya, who has a hair salon in Thunder Bay, and he says the past year has been absolutely and utterly devastating to his business. And, he had some advice for folks who do what you do for a living. So let's listen to that clip and then we'll come back and chat. Sheldon, if you would.
It's been absolutely catastrophic, not just business-wise, but personally. What's happened for us is our numbers are so far down, it's crazy. What's worse, more than our numbers being down, is what the Ontario government has done to really ruin the importance of being a hairstylist or a spa technician in Thunder Bay. We are only 4 different businesses that are still closed in the gray zone. So many of my friends and I, we walk around and think, we're almost better off dead than we are alive. We're worth more dead than we are alive, like the movie It's a Wonderful Life. It's sad.
That is quite a stark and shocking thing to say, but that's how Tony felt on budget night, and I suspect he feels the same way today. What do you say to business owners who believe they can reopen, they've spent the money to take additional protocols and precautions into account, and believe they can open safely and try to recapture some of their livelihood? What do you say to them, Mayor Mauro?
Oh, I think they're absolutely right. I do think there are a number of small businesses, hair salons, and private gym owners who feel they have been unfairly captured in the rules as they have been rolled out over the past number of months. I do know Tony, and I have talked to him directly on at least a couple of different occasions. I think, though, that as they are caught up in this, the province, if they're going to close down the entire province, they need to be accommodating these small businesses with whatever support programs they need to keep them whole and to help to bridge them through the pandemic. I would say something about Tony and others like him. Some of them who I've talked to, Steve, have been very clear. They are willing to still be in this position. Perhaps that's a bad choice of words. They understand why they might have to be in this position, but what they really wanted was to see a leveling of the playing field. They wanted to ensure that a lot of businesses who are still being allowed to operate unfairly, according to them, were gaining an advantage where they were being unfairly advantaged by having to be locked down. They were looking for a leveling of the playing field. That's language that Tony has used with me directly. And so to their credit, they understood that if they were captured in a lockdown, they thought that other similar industries and businesses needed to be treated the same. And so to their credit, they've acknowledged that directly to me. Having said this, this goes back to your original question about whether the pan-provincial lockdown is the right thing to do, when Thunder Bay's numbers right now might put us in what would be considered the old red range, right? Where a number of businesses like Tony's and gyms and hair salons would be allowed to operate. The province has gone away from the color-coded piece. They've gone to a pan-provincial lockdown. And again, back to my original point, I have to believe it's because they're believing the variants are going to cause spikes even in regions that are currently seeing relatively low numbers. I tie that back to the point I made earlier, then you need to be distributing the vaccines on a proportional basis.
No, I take your point, but Mayor Mrakas, what do you say to your small businesses in Aurora when they say to you, how come Costco's allowed to be open? How come Walmart's allowed to be open? I'm losing all my customers to them. I have to be shut down. This ain't fair. What do you say to them?
Well, that's been the frustrating part about this, Steve. I mean, we've advocated for a long time, I think since day one of this pandemic, is to create that level playing field, and to say to the province that if we're going to continue to need these lockdowns to bring the case numbers down, so that way we can take the burden off of our ICUs, then it needs to be done in a fair and equitable way. And so, that's what we've seen with this stay-at-home order now is where they've removed your Costco's, your Walmart's from being able to sell goods that are not essential. I think that's kind of leveled the playing field to a certain way for some of these small businesses to look at and say, okay, listen, if this is going to be the last lockdown, if this is going to be it, then let's have that level playing field. Let's get through it. Let's get beyond this. But I'm going to go back to the fact that we need to take that opportunity now, while we're in this stay-at-home order, and get the targeted, aggressive vaccine rollout out and get it into those hotspots and get it done. Because I can tell you, without that being done during these 4 weeks, it's going to be all for naught.
Mayor Clement, how big an issue is this big box stores versus small businesses playing out in Cornwall?
It has been an issue throughout the pandemic, and I know that our council has discussed it and made motions and sent those to the province to make sure that was being recognized. I do want to say that that story of the hairstylist is heartbreaking, and ones that are here too. The information from this latest lockdown, when that came through, I got a text from a hairstylist saying, I don't know if I'm going to be able to survive this. But at the same time, she's listening to information that's telling us that 70% of our cases in this area, this is information from our medical officer of health, are variants. So I think small businesses are suffering, and our community wants to support them with gift certificates, with curbside, as much as possible. But our community also understands that, we may start to have to advocate for ourselves as a hotspot, so that we can get better access to vaccine quicker, because our population is vulnerable. And so it's been difficult, very difficult for small business. I can say that our city rolled out small business loans very quickly early on in the pandemic last year. And we're now relying on the province and the federal government to support small business, so that we can hear fewer of these very heartbreaking stories that affect us all, and affect the mental health of not only those business owners, but many community members.
Mayor Mrakas, let me just let me do one more follow-up on this, and that is, I was driving by Yorkdale last night, the shopping center, and the parking lot was absolutely jam-packed. I don't know what to say about that, other than I know the Premier prides himself on keeping links between himself, his office, and you mayors strong. And I wonder if at any point you have had the conversation with him that goes something along the lines of, you're a small business guy, Premier Ford. How does this policy make any sense when the richest, biggest stores are allowed to be open, and the people who actually coincidentally probably form much of the base of the PC party in this province are not allowed to be open and are going out of business, And as we heard from the hairstylist Tony in Thunder Bay, the last budget was not all that helpful, or not helpful enough in his view to his needs and aspirations. What do we say about all that?
This is the frustrating part. I think from our businesses, they're losing their livelihoods. I mean, we're seeing it in Aurora and a lot of small urban centers where their downtown cores, their shops are closing up. They're just dropping their keys and they're walking away because they can't continue going on this way. And we've relayed this message time and time again to the premier that if we're going to do a lockdown, if this is what we need, if this is what the science is telling us and the data is providing us that we need to shut this down, well, then let's shut it down. It's, these half measures are not being productive and they're not helping our local economy. The way we look at it is you either open it up or you shut it down. This right now is not truly a shutdown because as we're seeing is a lot of those bigger places are allowed to stay open and they're seeing record profits.
Mayor Mauro, tell us about, because we talked earlier about the fact that you did have a spike in cases, which was very significant a few weeks back, but then the line on the graph did go down again. You did get it under control. How did that happen?
Well, the spike, Steve, I think it seems to be that it was connected to outbreaks in our correctional facilities. I can't say that with certainty, but it certainly seems to be a correlation, at least, between what was occurring in the correctional facilities and people being discharged, often, unfortunately, into homelessness, which led to community spread, which led to our spike. That piece seems to have worked itself through. I did make a call to the Minister of Health at one point saying, we have the highest incident rate in the province of Ontario, and yet you haven't declared us a hotspot. We need more help. We need more vaccine. We need to get this dealt with. And so over the past month or so, it more or less has resolved itself. I think that we have received for a period of time, I can't say how much more or for how long, we did receive a bit more vaccine, I think, for 1 week or so, which would have had a positive effect. And so we are seeing the numbers going down. But as I mentioned, we may be seeing the numbers going down now, but the variants have not yet arrived in any significance. They are here, but the community spread has not yet occurred. Going back to the previous discussion, this may be why the province has done a pan-provincial lockdown. And so they've gone off script from the original plan that was rolled out by General Hillier, that there would be this color-coded scheme. If you're in red, you could do A, B, and C. It goes back to the earlier discussion. Our numbers would now probably have us in red. Hair salons would be able to be open. Private gyms would be able to be open, but the province has made this decision to go pan-provincial and gone off script when it comes to the original color-coded plan.
Okay, back to Eastern Ontario. I want to ask you, Mayor Clement, about your hospital, because I'm told that as of last Thursday, the Cornwall Community Hospital was caring for almost 30% more patients than it has beds. And as you told us earlier in the program, you're starting to see patients now being transferred out of the region in order to get care. The CEO of the hospital apparently thinks this is going to get worse before it gets better. Any sense about how this happened?
Well, it's the variants. Clearly, after Christmas, we saw definitely a spike in cases, and there was a lockdown, and that seemed to be effective. But now we're being told that, as I said earlier, 70% of the cases we have are variants. The transmissibility is quite shocking. And so this is where we are. And we called a special council meeting last week to speak to our MP, our MPP, and more importantly, even our hospital CEO, Jeanette Dispati, who gave us some stark numbers. It's unprecedented. She used the word unprecedented. And she has been CEO for a number of years. She has wisdom and experience. And when she says that, we sit up and listen. And so our community now is focused on following those rules, following those regulations, and advocating for ourselves as a hotspot, getting pharmacies online so that more and more people can get access to the vaccine. That's where we are. And it's very concerning to hear a hospital CEO tell her community that the hospital is in trouble, that healthcare workers there are, in danger of being burnt out, right? And we are the regional hospital for Stormont, Dundas, Glengarry, Prescott, Russell for COVID. So we need help here. and we need access to more vaccine, more resources. We need everybody to get on the same page with messaging. I don't know how many people the other mayors are talking to, but people are tired. They're also tired of not understanding the different color codes and what's going on. We need clarity of message right now.
Mayor Mrakas, I see you nodding your head. You're not seeing a clarity of message coming out of the province?
No, you know what? Actually, I don't think it's just the province. I think it's all levels of government. The messaging is all over the place, and I think that everyone needs to start to take the politics out of it. Doesn't matter whether you're conservative, liberal, green, NDP, bloc. You know what? We need to all work together at this point. Get the messaging out that it's clear, understandable, because that's the frustration among what I'm hearing among residents, especially when you're talking about the vaccine rollouts. Here we are. We have the province on one hand saying, "Listen, we're gonna open it up and we're gonna start vaccinating hotspots and we're gonna start with the essential workers," and yet here in York Region, we're shutting down 2 clinics today. So, you know, when people hear that, they're like, well, what's going on? And so, you know, you have the Minister of Procurement at the federal level saying one thing, you have the Premier saying something else. You know what, guys? Put the politics aside. Let's get some accurate information out there and let's stop with the aspirational statements.
Let me do a follow-up with you, Mayor Mrakas, and that is for people who don't know the Greater Toronto Area, maybe watching us from other parts of the province, the city of Toronto itself, and then York Region where you are, essentially, Steeles Avenue is the dividing line. So when you're south of that line, you're in Toronto. When you're north of Steeles Avenue, you're in York Region where you are. Was it, in fact, the case before the province-wide shutdown was imposed that if people living in Toronto under lockdown wanted to get a haircut or wanted to do some shopping or whatever, would they come to York Region to do that? Did you see lots of evidence of that?
I think we saw it more in the south end. So in your Markham, Richmond Hill, and Vaughan, not so much in the northern part of the region. Ultimately, if they came up, they would, but we didn't see as much in the northern part, as I said. But I mean, it was recommended that people do not region hop, and so you know, there was that push to try to tell people, listen, stay within your own region. Regions were in different color codes, maybe, and that's what the ultimate push was, to create a province-wide stay-at-home order, was because they were seeing some of that region hopping occurring, especially with it between Toronto and New York Region.
Understood. All right, in our remaining moments here, let's go back to Northwestern Ontario and figure out how well, Mayor Mauro, do you think the vaccine rollout is working in your neck of the woods?
Well, Steve, I think for me, this is the central point that I'm sort of focused on now. We were on an Ontario Big City Mayor's call earlier this week. We had an emergency meeting, and Mayor Mrakas was on that call, I believe, and he would have heard me advocating for a proportional rollout of the vaccine across the province. So if you believe that the province in its entirety needs to be locked down and affecting those small businesses that we were talking about, not staying in the color-coded range, then it would seem to me that's being driven by some medical opinion related to what may be happening with the variants. And if that is the case, then the vaccines need to be rolled out proportionally. People in my region, in Thunder Bay, and our district health unit are seeing age groups as young as 18 having access to the vaccine. They're seeing other populations online being able to book an appointment for 50 and older. And so many of the other areas are not there yet. So it begs the question, why then would we all be considered to be locked down and those businesses not be allowed to open? And so for me, that's fundamentally the key. I can understand and appreciate we need to follow the medical opinion. That's important. If that's the case, say so very clearly, and then roll out those vaccines proportionally right across the province.
Mayor Clement, what do you need tonight, right now, from the province?
Definitely clarity of message, definitely support for our region being a hotspot so that we can get more vaccine. The city has supported the health unit throughout this process. Our paramedics are on duty. Our social services staff are there to support the vaccination process. Our arena is in play as a mass vaccination clinic. And so we need all the players to work together to make sure that people have access to as much vaccine as possible. We also need to target essential workers. I'm getting messages and messages from teachers, from the workers at our distribution centers, from healthcare workers. You know, they want to make sure that essential workers are also being targeted. So we need a targeted approach. We saw that worked for people in long-term care facilities, and we need to have the province continue with that approach. and make sure that municipalities are part of the process. We don't have the jurisdictional decision-making capacity, but we do have resources and expertise, and we want to support the province and the health units whatever way we can to make sure that our populations have access to vaccines.
Mayor Mrakas, I'm down to my last 30 seconds, and I'll ask you the same question. What do you need from the province right now?
I'll be quite simple: vaccines. That's it, clean and simple. But we need vaccines. We're running at York Region. We're running at a 33% capacity. We can do much more. All our municipalities. I know my mayor colleagues here today. We'll all say the same thing. We can get them in the arms of the people that want those vaccines if we have the supply. Get us the supply, we'll get the job done.
That's Mayor Tom Mrakas, the Mayor of Aurora, along with Bernadette Clement, the Mayor of Cornwall, and Bill Mauro, the Mayor of Thunder Bay. We're grateful to you three, your worships, for joining us on TVO tonight, and good luck.
Thank you.
Thank you.
Merci.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.